Are you still under a lockdown? Have you also long forgotten which day of quarantine is it? Have masks and sanitizers become your new friends? Well, it is the first time in history when a disease has affected each and every person in the entire world in some way or the other. While some countries have successfully won this battle, some are still fighting. So, while the world reels under the effect of the deadly pandemic coronavirus and the race to its vaccine continues, we will try to analyze the widespread devastation by their growing numbers that this disease has caused and its aftermath in some worst hit countries.
Starting off from where this all started, the Chinese province of Wuhan, known for its wet markets, is said to be the epicenter of this disease, from where it spread to the different parts of the world. A pneumonia of unknown cause was first detected here and was reported to the World Health Organization's country office in China on 31st December 2019. By 22nd January 2020, the novel coronavirus had spread to major cities and provinces in China with 571 confirmed cases and 17 deaths reported. From then, the cases started doubling, tripling till the outbreak was declared a public health emergency of international concern on 30th January 2020. China administered strict lockdown and stringent rules in order to clamp down this disease. Wuhan itself was locked down for about 4 months, with China lifting its lockdown on 8 April 2020 with the number of cases dwindling. Till date, China has about 83,057 total cases and 4,634 deaths. Coming on to the next country, the United States of America is the worst hit country in the entire world with more than 20 million cases leading to about 115,000 deaths. The epicenter of the US coronavirus outbreak, New York, a cosmopolitan city of nearly 8 million, has so far reported over 350,000 cases, which translates to about 1 cases per 55 people and over 27,000 deaths. As the cases started mounting, the President Donald Trump accused the World Health Organization to be China-centric, halting its funding to the World Health Organization. The US finds itself in a precarious position with records layoff, taking the unemployment level in the country to the highest since the Greatest Depression in the 1930s. With the number of daily cases falling, the US has started loosening the lockdown from 18th of May 2020 and bringing the economy back to life. When we talk about coronavirus, the Italy is one country we all are reminded of. The countless deaths of the frail and old and the sad situation of the hospitals will always remind us of the horrors of this pandemic. The match, a soccer game in Bergamo, which local media have dubbed as the Game Zero, was held 2 days before the first case of locally transmitted COVID-19 was confirmed in Italy. It is one of the biggest reasons why Bergamo has become one of the epicenters of the coronavirus pandemic, a biological bomb that busted and why 35% of the Valencia's team became infected. With 236,142 cases and 34,167 deaths, Italy till date remains one of the worst hit countries, with the older generation somewhat wiped off from that hotspot areas. Though Italy has now flattened the curve, it still reminds us again and again why social distancing rules are so important to avoid such a tragedy. Iran, a country of 83 million people, had become one of the global epicenters of the coronavirus with the highest mortality rate in the world. Based on official numbers, the mortality rate in Iran had fluctuated daily between 8 and 18% compared to the 3% in China and less everywhere else. The outbreak appears to have started in Qom, about 2 hours from Tehran. The first mention of the disease by the government was a report of 2 deaths in the city on February 19th. Initial reports indicate that the carrier of the virus may have been a merchant who traveled between Qom and Wuhan in China, where COVID-19 is believed to have originated. Iran till date have about 236,305 cases and 34,223 deaths. Though Iran had somewhat flattened the curve, it seems to be again reeling under the second wave of this disease. Japan is one wonder in itself. Japan's state of emergency was withdrawn in May, with new cases of coronavirus dwindling to mere dozens. What's surprising is that it got there even though no restrictions were placed on residents' movements. The business from restaurants to hairdressers stayed open. No high-tech apps that tracked people's movement were deployed. the country doesn't have a center for disease control. And even as nations were exhorted to test, Japan has tested just 0.2% of its population, one of the lowest rates among developed countries. Yet the curve has been flattened, with deaths well below 1,000 by the fewest among the group of 7 developed nations. Japan's battle with the virus first came to the mainstream international attention with its much criticized response to the Diamond Prince cruise ship in February that led to hundreds of infections, but it gave the Japanese an opportunity to study the virus quite early on, as a result of which they could understand its pattern of spread. It is also said that the contact tracing at the grassroots levels helped Japan to tackle it the best way. Next we come on to Brazil. With the hospital systems near to collapsing, Brazil has become the second worst hit nation after the United States. The virus was confirmed to have spread to Brazil on 25th February 2020 when a man from Sao Paulo tested positive for the virus. As of 11 June 2020, more than 8 lakh cases have been confirmed in the country, causing about 50,000 deaths. Also, Brazil has the second highest number of confirmed COVID-19 cases in the world behind the United States. The alarming increase in the number of coronavirus-related fatalities in Brazil continued on as the South American nation recorded around 909 deaths on the 13th of June itself. Despite the rampant spikes in cases and deaths, Brazil administration has reopened activities in major cities like Rio de Janeiro and Sao Paulo to boost the economy.
In Spain, another one of the hardest hit countries in this pandemic, the coronavirus spread quickly and widely without being detected, especially among the elderly, as a result of which the death rate became quite high, only second to that of Belgium in the European Union. The virus circulated under the radar a lot before the government ordered a near total nationwide lockdown on March 14th. The high death rate has been linked to many different factors, out of which lifestyle could have played a major role. In a country where people spend a lot of time outside in group eatings out, having drinks, attending religious processions, protesting, or just going for a walk.
The UK confirmed its first infection case following France and Germany on 31st January 2020. As of 12 June 2020, there have been 291,409 confirmed cases and 41,481 deaths, the world's second highest death rate per capita. The government came under constant fire towards its lenient response to this disease, with airlines like the British Airways, EasyJet and Ryanair launching legal action against them over a flawed 14 days quarantine system introduced last week. Many eminent personalities like the Prime Minister Boris Johnson, Prince Charles themselves contracting this disease. 1 month after France ended its strict 8 weeks lockdown, there has been no rise in coronavirus cases as life returns towards normality. The number of new COVID-19 cases continued to drop even as most of France reopened for business while maintaining physical distancing and protection measures, with the number of additional deaths down to its lowest figure since March. France's health authorities say that there are less than 1,000 patients in intensive care with the virus across the country, down from a peak of 7,148 in April. An estimated total of 29,319 people have died of COVID-19 in France in hospitals and care homes since the pandemic began. Of this total, more than a third of deaths occurred in care homes, but the government has stopped updating the figures because of the difficulty of accurately establishing a cause of death. Almost 72,000 people diagnosed with COVID-19 have recovered and been discharged from hospital. South Korea had witnessed a huge leap in coronavirus transmissions since 19 February within a month of reporting the first case. The cases increased multifold on 21st February, the majority of which them being reported in the city of Daegu. The increase was due to community spread traced to a church in Shincheonji linked to a patient number 31, a 61-year-old woman who was a frequent visitor of the church, acting as a super spreader, alarming the Korean health authorities. But the swift response of the government, including rapid testing and contact tracing, has helped them to successfully flatten their curve. Singapore too faced a similar surge in the community spread of the novel coronavirus. Russia has the world's second highest number of coronavirus cases but has registered 10 times fewer deaths than Britain, France, Italy and Spain. Russia as of 11 June 2020 had 252,245 confirmed coronavirus infections and only 2,305 deaths. that put it behind only the United States in the number of infections, but 18th in the world in total deaths and 58 in deaths per million inhabitants. New Zealand was declared COVID-free just last week, giving us all the hope that humankind can win after all. Others like the island country of Australia with about 7,000 cases and only 102 deaths has managed to avoid the worst ravages of the coronavirus. Several Asian economies like the Hong Kong and Taiwan appear to have contained the spread of the coronavirus within their borders, with the number of daily new cases slowing to trickle in the last few weeks. That's a feat that few globally have achieved, even as an increasing number of countries and territories have started winding down containment measures to get their economy going again. Lastly, our very own country India. With the case topping 3,20,000 and deaths about 9,000, India seems to have not reached the peak yet. With daily increase in cases, Maharashtra has emerged as a major hotspot with about more than 1 lakh cases there itself. With the unlock 1 phase starting, people have stopped taking social distancing norms seriously, which could be disastrous for our country. Even though the number of recoveries has exceeded the number of active cases, which is huge sign of relief, we shouldn't put our guard down. Always wear masks and go out of our homes only when necessary.